So what I am going to do today is to do it little differently. I am taking the help of a presentation also because I think this is a very important topic and we should not miss on any of the points. So I will keep a presentation shared so that we don't miss on any points during the discussion. So can you see my presentation?
Yes, sir.
Okay. And so we are going to talk about health, weight, and sugar during COVID lockdown. Uh, can anyone tell that everybody is seeing us and the audio is clear?
Sir, it's audible and it's clearly visible.
Okay, great, great. So
So now we would like to know about what is health and a healthy lifestyle from you.
so first and foremost thing is that health is, I think, the most important part that one should focus in lifetime. Health is defined as a state of complete physical, mental, and social well being, and not merely absence of disease or infirmity. सो हेल्थ जो है एक बहुत ही कॉम्प्रिहेंसिव ऑल इंक्लूसिव एस्पेक्ट है लाइफ का जो जिसमें आपकी फिजिकल हेल्थ भी इन्वॉल्व है, मेंटल हेल्थ भी इन्वॉल्व है, सोशल जो हेल्थ है वो भी इन्वॉल्व है, ना कि सिर्फ आप बीमार नहीं हैं, ऐसा नहीं है। और हेल्दी लाइफस्टाइल हम किसको कहते हैं? हेल्दी लाइफस्टाइल एक ऐसा लाइफस्टाइल है विच कीप्स यू फिट, आपको आपका एनर्जी लेवल अच्छा रहता है, यू एंजॉय ऑल एस्पेक्ट्स ऑफ लाइफ, यू और साथ में आपका जो रिस्क ऑफ डिजीज या डेथ है वो कम रहता है। सो इट इज नॉट ओनली दैट यू लुक हेल्दी, you are fit, energetic, you are enjoying life, you are at lower risk of disease and death both. And to have a healthy lifestyle, it is very important to have good nutrition, regular exercise, adequate sleep. All these are considered very important components of a healthy lifestyle.
So we are in a situation of lockdown. It had this lockdown has its own impact. So can you tell us about the detrimental effects of this lockdown?
Yes, so lockdown is, it's a very kind of unique situation which we are faced with during last 1 year, and we had a longer lockdown period during last year, and now again we are facing a week of lockdown. और इस पीरियड में जो इम्पोर्टेंट फैक्टर्स जो हमारी हेल्थ को इम्पैक्ट करते हैं वो है, एक तो फिजिकल इनएक्टिविटी, फिजिकल एक्टिविटी हमारी कम हो जाती है, वी बिकम मोर इनएक्टिव। हमारी ईटिंग बिहेवियर जो है हमारा नॉर्मली इट चेंजेस फ्रॉम गुड टू बैड, एंड देर इज अ टेंडेंसी टू गेन वेट बिकॉज फिजिकल एक्टिविटी कम है और हमारा ईटिंग बिहेवियर खराब है, वी आर ईटिंग मोर मोर जंक फूड, मोर कैलोरीज एंड सो ऑन. This leads to not only increase in weight, and for the diabetes patient it also leads to poor control of blood sugar levels. Blood sugar levels लोगों के बढ़ने शुरू हो जाते हैं. इन एडिशन स्ट्रेस लेवल बढ़ जाता है लॉकडाउन में, बिकॉज आप घर पे हो, काम नहीं कर रहे हो, मल्टीपल रीजंस हैं, वो भी हम आगे डिस्कस करेंगे. अल्कोहल कंजम्पशन बढ़ जाती है, कुछ तो स्ट्रेस की वजह से अल्कोहल कंजम्पशन बढ़ती है, कुछ लोगों को कुछ काम करने को नहीं है तो अल्कोहल कंजम्पशन ज़्यादा हो जाती है. नॉर्मली आपको अगर वर्किंग हो, आपको सुबह उठ के ऑफिस जाना है, तो लोग शाम को शायद ड्रिंक नहीं करते कि सुबह उठना है, टाइम से काम पे जाना है. अब आपको जाना ही नहीं है तो आप आराम से ड्रिंक करके सो रहे हैं, सुबह लेट उठ रहे हैं, तो ड्रिंकिंग इज इंक्रीज. स्मोकिंग बढ़ जाती है और सोशलाइजेशन कम हो जाता है. तो ये सारे फैक्टर्स जो हैं लॉकडाउन में आपकी हेल्थ को एडवर्सली इम्पैक्ट करते हैं. So let us talk about physical inactivity first. What is physical inactivity? Physical inactivity is basically lack of physical activity or insufficient physical activity. सबसे इम्पोर्टेंट चीज ये है कि लोग इस चीज को नहीं समझते कि फिजिकल इनएक्टिविटी एक मेजर रिस्क फैक्टर है for all non-communicable diseases like diabetes, blood pressure, heart disease, and also important risk factor for early death. स्टडीज में देखा गया है कि जो लोग फिजिकल जिनकी एक्टिविटी बहुत कम है, उनका रिस्क ऑफ हार्ट डिजीज, डायबिटीज, कैंसर और नॉन कम्युनिकेबल डिजीजेस एटलीस्ट 30% तक बढ़ जाता है। और फिजिकल एक्टिविटी ये रिस्क को कम कर देती है। नॉट ओनली दैट, जो लाइफ स्पैन है फिजिकली इनएक्टिव लोगों का, दैट इज शॉर्टन बाय 3 to 4 years। सो फिजिकल इनएक्टिविटी एक बहुत इंपॉर्टेंट फैक्टर है जिसको हमें डेवलप नहीं होने देना चाहिए इस लॉकडाउन में। फिजिकल एक्टिविटी के अपने बहुत सारे एडवांटेजेस हैं, और फिजिकल एक्टिविटी एज यू नो इज वेरी इंपॉर्टेंट एस्पेक्ट ऑफ लाइफ टू कीप वन सेल्फ हेल्दी एंड वेल। फिजिकल एक्टिविटी बेसिकली हम कहते हैं किस चीज को, सिंपली मूविंग बॉडी एंड all those movements which consume energy. So basically movements of body which involve skeletal muscles, जो हमारा मस्कुलर फ्रेमवर्क है जिससे कि आपकी एनर्जी कंजम्पशन होती है। WHO ने जो फिजिकल एक्टिविटी को डिफाइन किया है वो दैट इज डिफाइंड एज एनी बॉडीली मूवमेंट विच इज प्रोड्यूस्ड बाय स्केलेटल मसल्स दैट रिक्वायर एनर्जी एक्सपेंडिचर। और ये एक्टिविटी कुछ भी हो सकती है, जब ये आप काम कर रहे हैं, जब आप खेल रहे हैं, आप रूटीन हाउस होल्ड काम कर रहे हैं, वॉक कर रहे हैं, डांस कर रहे हैं, योगा कर रहे हैं, कुछ भी फिजिकल एक्टिविटी जो है वो आपकी जो एनर्जी कंजम्पशन कर रही है उसको फिजिकल एक्टिविटी कहते हैं। एक्सरसाइज और फिजिकल एक्टिविटी में क्या डिफरेंस है? एक्सरसाइज जो है इज अ फिजिकल एक्टिविटी दैट इज focused for achieving health or benefiting on health and is taken very regularly, and it is of sufficient duration and intensity and involves repetitive activities. All ages, irrespective of whether you are young, middle age, old age, very old age, स्टडीज ने बड़ा क्लियरली शो किया है कि अगर आपकी फिजिकल एक्टिविटी अच्छी है तो you are always on benefit side as compared to the risk of physical activity, जो कि हम सोचते हैं कि ओल्ड एज में फिजिकल एक्टिविटी नहीं करनी चाहिए, आदमी गिर सकता है, इंजरी हो सकती है, आपको ज़्यादा एग्रेसिव फिजिकल एक्टिविटी में एक्सीडेंट्स हो सकते हैं। Calculating all those risks also, the benefits of physical activity are far more than the risks associated with physical activity. So physical activity is very important component that one should focus on. And exercise, as I mentioned, is a subgroup of physical activity which is planned, organized, repetitive movements carried out to sustain or improve health and fitness. Apart from exercise, any other physical activity done at any place also has its own benefits on health.
Sir, how much physical activity is needed for good health as per guidelines?
So that is another important question. The general recommendation is that all adults in the age group of 18 to 65 years, at least 150 minutes of moderate intensity physical activity should be done throughout the week. So at least 30 minutes performed 5 days a week, which accumulates to 150 minutes, is required, or at least 75 minutes of vigorous physical intensity physical activity. Now, what is moderate intensity physical activity? So let us not go into METs and those details. Generally, brisk walking, cycling, and swimming are considered moderate intensity physical activity. Now, jogging, aggressive, cycling, very fast cycling, intense swimming, all these become vigorous intensity physical activity. Running on a jogger or cardio, doing those cardio training equipments, taking your heart rate to say target heart rates, all those things are vigorous physical activity. So physical activity also includes leisure time activity, which can be walking, gardening, any other activities that you do all through the day. And it also helps in achieving, health. For additional for maintaining health, this much activity is required for maintaining normal health. Now, if you want to improve your health, you want to have more, muscular uh, structure, you want to improve bone health, bones become stronger, muscles become stronger, your heart, cardiorespiratory fitness improves. So, for that, you should increase your physical activity to moderate physical activity done at least 300 minutes over a week period, or a vigorous intensity activity for about 150 minutes.
So, as if somebody is performing less activity than this,
So, there are studies which have compared the individuals who are performing the recommended activity and the lesser activity or in the inactive period. So, those people who have low volume activity, which is the average exercise performed for about 90 minutes per week or 15 minutes per day, also have 14% reduction in the risk of all cause death, and they have 3 years longer life expectancy as compared to those individuals who do not perform any physical activity. So even 15 minutes activity done per day has health benefits. Every additional 15 minutes activity further reduces the all cause death by 4% and the cancer risk by 1%. So if you just increase your physical activity 15 minutes a week, this improves your health risk, this improves your cancer risk also. 15 minutes a day or 90 minutes a week of moderate intensity physical activity is of benefit even for individuals who are at risk of heart disease. And if you compare the people who have the least activity, that is less than 17 minutes per day, people who are doing 30 minutes per day, they have 14% reduction in the risk of death. And if you replace this physical inactivity with moderate physical activity, it is associated with 45% reduction in the death rate. So if you improve activity, it improves health, it cuts down the risk of disease, cancer, and cuts down the disease of death, risk of death also. Now, if we look at the detrimental effects of sitting and replacing this sitting time with active behavior, so high amounts of sedentary behavior have been associated with increased risk of several chronic conditions and increased death risk. High levels of moderate intensity physical activity done even for 60 minutes per day seem to eliminate the increased risk that is associated with prolonged sitting time. Now, this risk is not attenuated if this sitting is associated with TV viewing somehow. So, TV viewing is supposed to be one more factor which is, detrimental for health if it is done over longer periods of time.
so you're talking about physical activity, but during this lockdown, how what can we do to continue with the with being active, with being physically active?
So, what we are seeing in the clinic practice today in nowadays is that everybody tells talks of lockdown में तो हम कहीं जा नहीं सकते, अब कैसे हम activity करें, क्या करें? So it is very important to find ways to increase your physical activity during the lockdown period. Uh, you can, simply do some stretching exercises on regular basis at home. You can do twice daily because you are sitting at home, you're doing nothing. You can do it in splits of 15 minutes, 3 to 4 times a day. Whenever you are feeling bored, you can do some physical activity. If you have a treadmill or a static cycle, you can use some equipment at home. Some people have gyms at home, so they can perform regular activity. You can do yogic exercises sitting at home. uh, you can download some videos on YouTube. Everybody is now watching social media, YouTube, TV. So why not open up a channel which has dance and start learning dance, practice dance, do some activity or physical activity, watching some videos. And otherwise you can keep doing some stretching exercises, muscle training at home. You can use various gadgets, simple gadgets like trucks or weights which can be used at home to keep yourself physically active and do some stretching exercises. So you can or you simply walk inside the house and time it. You make sure that you walk for say 1 hour every day inside the house only. And you can always activate a gadget app, something like Google Fit or some physical activity app on your phone, and carry your phone and just see how many steps you are doing, and target 8 to 10,000 steps walking at home only. So you can increase physical activity. There should not be any reason why you should stop physical activity during lockdown.
So we have a lot of social groups also these days who encourage these groups. They encourage socially a group physical activity basically.
Yeah, yeah, there are a lot of groups which are doing that actually. So in fact, again, you have to connect on social media. You can connect on Zoom. People are doing physical activity classes on Zoom, aerobics classes on Zoom. There are aerobics videos on YouTube. So you can, do a lot of activity using all these media.
So one more thing which we have seen during this COVID period is we tend to develop bad eating behavior. How will you explain this bad eating behavior?
Yes. So whenever we are sitting idle, we have, multiple reasons to indulge in eating. In lockdown period, basically we are confined to home, nothing to do. It is boring day. We are sitting all the time in chair, most of the time working on laptops or doing nothing. Children are also, confined to home. Their classes are also on videos, and after that they have nothing else but to play with the cell phones or laptops, or watch TV and eat popcorns using remote, sitting ideal in the couch. People are working from home all the time, glued to screen. Again, lack of physical activity. The house helps are not coming because of lockdown. So there is increased dependence on junk food and food delivery now. And food delivery is open. It is available easily. All you need to do is make a phone call and get your food delivered. And that this is all leading to an increase in fast food culture. Fast food culture is especially emerging for the younger generation because it is now ready availability of fast food. Fast food is tasty, low cost. Every single day you are seeing discounts coming on Swiggy and Zomato, or the pizza, Domino's offering 1+1, Pizza Hut offering 1+1, Burger King offering 1+1. So a lot of marketing strategies, to the extent that small children feel that these foods are actually normal foods. What are you giving us? So this is a cartoon which I picked up from some place, where just shows that impact of marketing can be so strong that children feel that this is a normal food and this is so tasty. So eating chips or French fries is, it should be a regular part of meals. And another thing is, food has been associated with happiness, not only because of the marketing strategies, because of the culture also. Every single festival you will have some special food. You have Holi, you will have Gujia. You have Diwali, you will have something else. You will have, you are in, Vaisakhi, you will have those different sweets coming from different parts of country all the time. And every few days there is a small festival where you are cooking some special food at home. Yesterday we had, this Ashtami, and everybody is having puris and halwa. So food is associated with celebration, happiness, and we have our own junk foods. Our foods are, they beat the Western foods as far as the amount of calories is concerned. This plate of samosas has more calories than a, double cheese pizza. So we are not far behind them as far as the calorie intake is concerned in terms of junk foods. And these foods are much cheaper than healthy foods, and they are easily available. They are being delivered at home. So they, and even for fast, now you fast means it's a feast. So we have reasons to eat, and feel that eating these foods will make us happy. But ultimately, all these foods are adding to excess calorie intake and obesity, and leading to chronic diseases. And these facts have been very well documented and published in leading journals. So bad eating behavior is leading to weight gain and poor control of blood sugar in all diabetes patients.
So how to maintain body weight during this period?
So, what we are doing, we have to go exactly opposite. The most important thing is that we should focus on regular physical activity. Despite lockdown, I told you, we can do multiple things where we can stay physically active, and we should focus on appropriate eating behavior. Since we are physically inactive, we should cut down our eating. We should eat only that much which is required to keep our appetite, satisfied. We should cut down the intake of high calorie foods, which includes fried food or high sugar foods. We should cut down the drink intake of high sugar drinks, alcohol. We should eat more salads and fruits. We should try to, eat, cut down the portion size, and we should keep weighing our weight regularly so that we know if we are gaining weight, we have to cut down, focus on or correct our eating pattern and increase physical activity. So both are very important in maintaining normal body weight during COVID period. And it is very important to stay fit because the studies have shown that even people who are normal weight or lean and thin but are not physically active actually have higher risk of heart disease and death as compared to people who are obese or overweight but are physically fit or aerobically fit or very active. So this graph actually, this is from a scientific study, but I just kept it here to keep me reminded that I must highlight this point, that if you are not overweight or obese, don't think you are healthy. To stay healthy, you have to be fit. You have to have regular physical activity. You have to have regular muscular activity so that your muscles are toned. You are having good cardiorespiratory fitness, your inflammation levels are low, and you are physically fit, and then only you will be safe.
Sir, so you mean to say that it's only you who has to decide what to do,
Yes,
to behave,
yes,
and this COVID period you can utilize to build a better you, basically.
yes. And there are lots of benefits of regular exercise. If you are doing a regular exercise, it reduces your risk of high blood pressure, heart disease, strokes, diabetes, various cancers. It improves your respiratory fitness, which is, respiratory system is one which is getting affected during COVID period. It also strengthens your bones and joints, and it improves your balancing. It improves your risk of osteoporosis, so your bones are strong. You are unlikely to fall. You are unlikely to get fractures in older age, and you are more likely to stay fit. And not only that, if you are physically active, it helps keeping your mental functions also better, and it also cuts down the risk of depression or the the disturbed sleep. If you are physically active, you burn more calories during day, you tire yourself, you sleep well, and your bodily functions are also improving, and you have better coordination between mind, body, all systems, and your metabolism, everything is improving towards good. So
So,
I
sir,
think it is very important to focus on physical activity.
you mean to say there is no reason for being physically inactive.
Yes, absolutely.
So, one more aspect which we have to focus on is stress. Because of this COVID, there's a lot of impact on our mental health also. We would like you to talk something about stress and how to cope up with it.
So I was going to talk on stress, but before that, I wanted to touch upon the poor control of blood
Okay,
sugar
right,
in
right, sir.
diabetes patients. So just quickly, I will do that. Uh, uh, what is happening is, because of this loss of physical activity, lack of physical activity, and overeating and junk food eating, and all that stuff, the blood sugar levels are going haywire, and we are seeing patients on very frequent basis who are coming with lack of control of blood sugar levels. So I think it is very important to maintain a good control of blood sugar levels, because if you are poorly controlled, you will be at higher risk of getting infections and higher risk of getting complications. And during COVID period, people with diabetes, if they are well controlled, their risk of getting infections is not high, but if they are poorly controlled, they will get higher risk of infections. And people who are poorly controlled are doing bad with COVID, they have higher risk of getting admitted to ICU, they have higher risk of getting on ventilators, and they have higher risk of death. And so is the case of obese individuals. So maintaining blood sugar control during COVID period is very important for all diabetes patients. And to do this, again, the basic things are maintain regular exercise, make sure that you are eating as has been advised by your dietitian or your physician, so that you are maintaining your sugars as they have been maintained earlier. You are taking your medications regularly and on time, and also keep monitoring your blood sugars regularly. Not only that, also keep in touch with your physician on regular basis to review your treatment and the success of treatment. And if there are any treatment changes required, if any vaccination requirement is there, or if there is a change in medication required, regular tests are showing something else, then you should do that. So all these things are very important as far as the blood sugar control is concerned. Now coming to stress, let us see how does it affect. So there are multiple things which are leading to stress. One is confinement to home. You are sitting at home, you are doing nothing. Then there is, people have lost job. There is loss of income, loss of work. You're doing nothing. You don't know how to survive. There is fear factor that you might get COVID. If you get COVID, the whole family cannot move to a different house. You have a limited accommodation. What will happen if the COVID is somebody gets infected with COVID? If hospitalization is required, there are no beds. There is lack of oxygen supplies. So all these factors are leading to a lot of fear factor. Then you are socially disconnected. You are not meeting anybody face to face, and if you are not good with your social media skills, then you are socially disconnected. Uh, because of all this stress, there is tendency towards lack of interest in what is happening in the surroundings, or do something different and keep busy. There is loss of physical activity. People are afraid to go out, so physical activity comes down and it leads to poorer health. Since they are sitting at home, they are depressed, there is tendency towards overeating and binge eating just to overcome depression or boredom. There is tendency towards alcohol intake, increase in alcohol intake. So all these are leading to, are kind of manifestations of stress and leading to poorer health. To overcome stress, it is very important again to maintain a regular physical activity, to have a good eating behavior, eat a lot of fresh fruits, vegetables, salads, eat, right, eat the right portion sizes, don't overeat, don't eat too frequently, don't use eating as a measure to kill boredom or to cope up with the depression. Maintain regular physical activity, try to do some meditation, try to get involved in activities that are of your interest so that you feel happy and you are not affected by stress. So all these factors are important once you are in lockdown period to overcome stress.
So one more factor what which we are seeing these days is rush outside the alcohol shops. There was a video viral few days back of the lady talking about alcohol intake. What are the reasons for this excessive consumption of alcohol and your take on alcohol?
So alcohol, I think specifically we kept in, I kept in this presentation part also was to, make sure that we touch upon this topic. As I mentioned, yesterday there was a big queue outside alcohol shops because the lockdown was starting, and there was a lot of hue and cry, and people wanted all the alcohol stocks at home so that they don't miss on alcohol during the lockdown. So there are a lot of stress factors which are involved. There is increased stress, lack of physical activity, boredom, and all these things, and ultimately they are one of the factors which lead towards excessive alcohol intake. Now, one thing one should keep in mind that alcohol intake in excess certainly has a number of disadvantages. Alcohol has harmful effects on practically excess alcohol intake has harmful effects on practically all parts of body, especially liver, brain, kidneys, lungs, bladder. It can lead to increase cancer risk. It can lead to increase risk of impotence in men and women. It can lead to osteoporosis, liver damage. We all know brain function can get compromised. So there are multiple bad effects of alcohol. Not only that, alcohol provides empty calories and therefore leads to increase in weight gain. So excessive alcohol also is known to suppress appetite and interfere with the absorption and metabolism of nutrients. So there are other nutritional deficiencies which can come up with alcohol. In diabetes patients, alcohol can lead to serious lowering of blood glucose levels by suppressing the liver. And these serious hypoglycemic episodes can be life threatening. So, and can lead to emergencies. So excess alcohol intake is, strictly no, and it has to be avoided by all means.
So how much one can take?
So, alcohol in totality, we can say is not bad. If somebody is having, moderate alcohol consumption and it's a regular habit, maybe one can continue. But important thing is we should know what is moderate alcohol consumption. So moderate alcohol consumption is defined as having up to 1 drink per day for women and up to 2 drinks per day for men.
So can you specify in ml?
So I will come to that also. And this means 1 drink is 1.5 ounce or 45 ml. And this refers to amount consumed on a single day. And this cannot be averaged. That you take 7 drinks in a week, 1 day in a week, and this is moderate alcohol. So it is 1 drink per day. It is not 3 drinks on 1 day and twice a week. So even if you are consuming twice a week, it is 1 drink per day. This is moderate alcohol consumption. And second thing to keep in mind is that people who don't drink alcohol, it is not recommended to advise them alcohol intake. It is not going to be beneficial because alcohol has a addiction potential. So one should not be advised to take alcohol unless it is a good, healthy drinking behavior that person is following over a longer period of time. Now, second thing you have to keep in mind is all these figures are for Western population, white population. Indians have a smaller body frame, smaller body weights. So it is some of these studies have shown that alcohol intake of the drink, 1 drink for Indian population should be defined maybe at 30 ml, not at 45 ml. That is why we say that not more than 60 ml for men per day should be the intake. Now, one standard drink is defined as 14 grams of pure alcohol, which is equal to 330 ml of beer or small pint of beer, or about 150 ml of wine, or about 45 ml of hard liquor like whiskey, rum, or gin. But for Indian people, I think we should keep the drink size to 30 ml and not more than 60 ml for men and more than 30 ml for women should be considered as moderate alcohol in the consumption. Moderate alcohol consumption has been shown to have some health benefits like reducing the risk of heart disease and cardiac deaths, and possibly reducing the risk of stroke and some cancers also. And there are some studies that it reduces the risk of developing diabetes also. But this is to be kept in conjunction with other healthy habits of increased physical activity and proper eating. Binge drinking is strictly no. Binge drinking is considered when a person is taking 4 or 5 more drinks for women in one single occasion and 5 or more drinks for men in single occasion, usually consumed over 2 to 3 hours. Excess alcohol intake is defined as more than 7 drinks for women per week and more than 14 drinks for men per week. Any alcohol consumption in pregnancy is strict no and should be totally avoidable under children of 80 children under 18 21 years of age. That is what is excess alcohol intake. So there may be tendency towards increased alcohol because it offers as one of the coping mechanisms, but it is not a coping mechanism. In fact, it can lead to increased risk of panic and anxiety disorders. It can further worsen the depression and mental disorders, and can lead to risk of family and domestic violence also. So it is not a good coping mechanism. So excess alcohol has to be avoided by all means.
So any relation between alcohol and COVID?
So this is also a very important question. Initially people thought that alcohol kills the COVID virus. So why
That
not?
video
People.
viral was saying the same thing by
So
that lady.
people started doing, gargles with alcohol. People started consuming small amounts of alcohol. Some people started, smelling alcohol to begin with, to kill the COVID virus. So I think there was, since this confusion was there, there was a white paper on excessive alcohol consumption and risk of COVID by WHO published in 2020, and this has taken off certain myths and it has answered some very important questions. So first question was, consuming alcohol destroys virus that causes COVID-19. The answer to this is that, and consuming alcohol will not destroy the virus, and its consumption is likely to increase the health risk if a person becomes infected with the virus. So if you are consuming alcohol, you in fact get infected with COVID-19, your risk is high. Drinking strong alcohol kills virus in the inhaled air. Again, it is not true. Consumption of alcohol will not kill the virus in the inhaled air, and it will not disinfect your mouth or and throat, and it will not give you any kind of protection against COVID-19. So this should be very clear. Another question is, another myth is that alcohol can stimulate immunity and resistance to the virus. In fact, alcohol has a bad impact on your immune system. It decreases your immune power. It decreases your resistance against viral infections. And that is why it poses increased risk of COVID-19 infections.
So smoking is also a very sensitive issue which needs to be touched on today.
So the answer on this slide is very clear that one has to quit. There is no relaxation with smoking. Even single cigarette smoking is bad. It adversely affects your respiratory system, and respiratory system is the most vulnerable system in COVID scenario. So you should make sure that you maintain a good respiratory health as far as possible, and cigarette is strict no. Beyond this, strict cigarette further damages, cigarette actually leads to increased risk of disease in every single part of the body, because it leads to something called increase in oxidative stress. It leads to increase in endothelial dysfunction, which impairs the functioning of all blood vessels and leads to impaired circulation in all the organs. In addition, smoking leads to increase in risk of cancer practically in all parts of body. So smoking is a strict no. There is no second thoughts about smoking.
So what we are seeing today is we are socially isolated. We are stressed. How to cope up with this social isolation during the crisis which we are going through?
So, social isolation is one of the things that is causing problem, and we know that because of social isolation, there is increased stress, there is, you, boredom and everything. But there are enough social, media platforms and platforms to connect with people, and we all are getting connected on Zoom on daily, day-to-day basis. This is just one of the pictures from our research society meetings. We are having regular meetings on Zoom platforms where everybody gets connected. People are having parties on Zoom. People have had weddings on Zoom. People have had all kinds of celebrations on Zoom. People can connect on WhatsApp calls, Instagrams, and so many things are there. There is no reason why you should be socially isolated. Try to stay connected with your friends, with your families. Keep informed about what is happening around you. You know, pick up the news from right channels. Don't focus on trash news. Don't focus on WhatsApp University and Facebook University, which is giving, trash information. There are some people who are always doomsday predictors. They will be predicting all negativity. Stay away from negativity, and all those things are important in this setting.
So, what is the take home message for us for today's session?
So I think we have touched upon quite a few points relating to this lockdown, and the take-home message would be that most important thing is that we should focus on health during the lockdown. We should not let our health be compromised. We have to maintain a healthy eating behavior. As mentioned, eat more greens, fruits, take less of calories, take less of fried foods, don't do binge eating, avoid junk foods, maintain regular physical activity, keep a watch on your weight. Alcohol intake, if it is there, should be in moderation. Excessive alcohol intake is going to be bad. Maintain social connect using different, media and channels of communication. And most importantly, keep a positive attitude. All these things are going to be very important, uh, you know, taking to tide over the crisis of COVID and specifically the periods of lockdown.
So, I think being positive is the need of hour. We need to be
Yeah,
very, very positive.
so I
Sir,
think this
sir,
was
I'll ask you a question before we end the session.
no, we can have all the questions if there are any.
Sir, there is a question from a patient from Kenneth. He has the question of what activities are recommended for a recovering COVID patient.
Okay, so as far as the person recovering COVID patient will need rest, so we should not push them into aggressive or moderate physical activity also. Any recovery from any illness, I think that period one should be advised to stay rested. Now, stay rested does not mean that you are physically inactive and confined to bed. You should be mobile. You should, walk about in the room. You should be sitting in chair for some time. You can go do some reading, watch TV, and so on. But you don't need to be regularly exercising. And once the patient starts feeling fit enough to start exercise, person can resume exercise and gradually build up. So no exercise immediately during the recovery phase. And make sure that during recovery phase, person is having good hydration, getting adequate nutrition, healthy eating, and so on.
Deep breathing definitely helps these patients.
Deep breathing, but that this we cannot. This is not an
We cannot,
exercise.
yeah,
This is a
right.
basically recovery tool.
So we don't have any questions for the session today.
Good. I think people have understood everything that we have spoken, and maybe we'll have questions, in next few days that we can, post on the in the answers.
Definitely, sir, we'll do it.
So thank you, Dr. Kirti, for setting this up, and thank you everyone who has joined the Facebook Live. And this is our endeavor to keep on disseminating uh, healthy, lifestyle. Uh, the information about maintaining good health, especially in patients with diabetes and obesity, which is the area that we are working, and this is an endeavor to disseminate more information about maintaining health in patients with diabetes and obesity as far as possible, and try to we try to disseminate this information to all the people who can connect with us. Maybe this will help in improving health of our patients. Our patients means all patients with diabetes and obesity in India, to whatever extent we can do it. And that is why we are trying to do this Facebook Live every week, every Wednesday 3 to 4, picking up on topics which are affecting our health on day-to-day basis. Hope you are enjoying connecting with our Facebook live page every Wednesday, and you can pass on this information to your friends who you think can benefit from our Facebook live. Thank you everyone, and with this we will end this session here.
Thank you. Hope to see you soon.
Thank you.